Thank you. As I was introduced, I'm a learning disability nurse. It's a small branch of nursing that not everyone knows about. And I've worked in learning disability, autism and mental health services in the NHS for about 18 years. I currently work for an ICB as part of a programme called Transforming Care, which is embedded in the NHS long-term plan. And that came about following the Winterbourne View scandal in 2011, if anyone knows about that, when horrific abuse was exposed of people with disabilities in mental health hospitals. So teams were set up. It took campaigners till 2019 to get this in the NHS long-term plan. It's there now. We're working on keeping people at home rather than them being in hospital, which we know doesn't give the best outcomes. Unfortunately, like a lot of other people working for ICBs, we found out via the media 2 weeks ago that we might actually lose our jobs. So they're making 50% cuts. And what I found difficult about that is Wes Streeting's framing of it, that we're getting rid of the bureaucrats, we're getting rid of the fat cats in the NHS on inflated salaries. Well, I'm a nurse, I see patients every day. I'm not on an inflated salary, I'm on the same salary as the rest of my colleagues across the health service. So it's just another bit of awful framing from this government. And I do really question this government's priorities, who can always find money, as we're talking about, for bombs, death, destruction, in their words, to make Britain a defence industrial superpower. Now, this investment in Britain's war machine, it could be used to make people's lives better by investing in the public sector and addressing these huge inequalities that we face nationally. But instead, the people who struggle most in our society are continually being driven further into the ground, abused, neglected and cast aside. Now, for us working in the NHS, the 1st of April is the date that we're due our annual uplift of pay. Instead, we've got a wall of silence yet again. Staff are really, really angry at this absolute betrayal by the Labour government, yet another one. And these are the reasons staff are leaving. This is why the crisis in the NHS continues to deepen. Now, in previous years, for as long as I can remember working in the NHS, the announcement and our subsequent uplift is always late. However, when Labour won the election, they promised they would address our pay. They promised uplifts would happen on time and not leave us in the dark like other governments. But here we have another situation where you can't really see the difference between Labour and the Tories. Now, because of this delay, Band 2 staff, who are the lowest in the NHS, have been given an emergency uplift of their pay, because without having that emergency uplift, they'd have fallen below the national minimum wage and would be on illegal hourly rates. Now, these staff are the people doing some of the hardest jobs in our hospitals: cleaning, cooking, support workers, porters, maintenance, earning £12.26 an hour. And to note, when we do get our pay award, the emergency uplift that they've had will be taken off that, so they'll get even less. This is absolute scandal, a stain on Labour. Now, I was community nursing for adults with learning disabilities in Hounslow when the benefit system was overhauled as part of the Welfare Reform Act in 2012. And this is when we saw personal independence payments come in, which replaced DLA, for those that can remember. And now people are being faced with another overhaul. Now, what I saw when I was nursing was the introduction of PIP was incredibly challenging. As was discussed, applications for PIP are certainly not easy. It was really, really traumatic. And I remember an individual I was working with telling me that his PIP assessment was the single most humiliating experience of his life, and he was left feeling less than human. Many were left to go through appeals. For those that didn't feel able or were unable to, they could face having their benefits sanctioned. I remember finding one elderly gentleman I was working with in the community. I went round to see him, and his house was in dark, in cold. He was in bed in all of his clothes, under blankets. His benefits had been sanctioned. His power had been cut off. He lived alone. He couldn't read. The letters had been piled up, and he hadn't been supported to access the information. And I'm really, really worried about what we're going to see happening in our communities with this benefits overhaul. Now, thinking about that accessible information does take me to quite an important point around the current overhaul. Nothing's been prepared in easy read or accessible format for people with disabilities to access. No one from the disability community, activists or charities have been consulted to be part of developing this impact assessment for proposed changes. Now, for those of us working in the field of disability healthcare, we always underpin our practice with nothing about us without us. And this is something the Labour government would do well to consider. The needs and voices of the disability community should be at the heart of this plan, not as an overthought. Now, the charity Scope have done a lot of analysis of these figures, and they show that without PIP, a further 700,000 more disabled households could be pushed into poverty. And these attacks on the welfare state, as Pfizer was talking about, they set a really, really dangerous precedent and are a world away from the politics of the Labour Party that founded the NHS. Now, the justification by Labour is that these cuts will help sick people back into the workplace. It's absolute rubbish. PIP is not an out-of-work benefit. In many cases, payments help disabled people travel to their jobs. My colleague, a social worker, is blind. She receives PIP and it helps her work. Without that, she wouldn't be able to come to work. People who are unable to work because they're disabled, sick or caring for others deserve to be treated with our dignity and respect. And Labour's justification for the cuts makes very little economic sense and is rooted in the kind of demonisation of people who rely on the welfare state that we have seen under successive Conservative governments. And this is a disgraceful narrative being pushed by politicians and the media. One quote I really found particularly disgusting by Liz Kendall was that saying, behind every one of these numbers is someone whose potential isn't realised, whose ambitions aren't fulfilled. No, this infantilises disabled people and assumes that those not in work are unfulfilled and wasting their potential. People should not be judged on their economic value, and we have to reject this narrative, all of us. We also had Wes Streeting, our new mental health professional, giving us the unhelpful and ridiculous comment, there's an overdiagnosis of mental health conditions. This is inaccurate, stigmatising, harmful and misleading from a health secretary. And I don't think we should take any lectures from an MP who's received more donations linked to private healthcare than any other MP, an estimated £175,000. Now, finally, I just want to mention the effects that these cuts will have on an already under-strain NHS. We can expect to see people struggling with their health conditions, potentially leading to more A&E visits and an increased demand for services. Those forced further into poverty may struggle to afford essential needs, food, heating, medication. And I was reading a report by the Disability Poverty Centre who's warned that benefit cuts could actually lead to 1.2 billion in extra costs for health and social care services. Cutting carers' benefit also, for the first time in decades, will also potentially lead to more people requiring formal care, which will put further strain on our social care colleagues who we know have been stripped back to the bone also. So finally, we've got to keep holding this government to account on their privatisation and dismantling of our NHS, attacks on disabled people and insistence on ploughing billions into defence. This is indefensible and immoral, and we must continue this fight back. Thank you.